I will go ahead and get started. First of all, I want to thank Lupus LA for bringing me on this platform to have this virtual program through Facebook. I think this is such a wonderful opportunity for all of you out there to be able to engage in. Just to introduce myself, my name is Sheetal Desai. I am a rheumatologist. I do focus on lupus. I've been at UC Irvine in Southern California for the last got 13 plus years, and I run the UCI clinic at UC Irvine. I really love lupus. Lupus is pretty much all I do. I live, breathe lupus, do clinical research in lupus, and I really feel very close to my patients in clinic. Today, for the purpose of this talk, I was going to start with some of the top questions that I get from my patients when I see them in clinic and kind of go through the questions they ask me and the answers that I actually provide them. And then at the end, I'll open it up to Brianna from Lupus LA, who will be taking questions kind of as they come in and will be sharing some of them with me so I can try to answer them during this live format. So to begin, the first and most common question I get in clinic is, if I have lupus, am I at higher risk of contracting COVID-19? Sorry, right before this, I drank water and I think I choked on it. So I might be kind of clearing my throat throughout this. So that's the most common question I get. Now, if any of you guys go to the CDC website, so the Centers for Disease Control website, they will actually identify high-risk patient populations, kind of mixed risk patient populations, kind of low-risk patient populations there. And if you go look, you'll find that lupus is not listed in the high-risk patient population. Lupus does cause dysregulation of the immune system. And so patients with lupus, theoretically, because their immune systems aren't working like they normally should, can be at higher risk of infections. But I will see clinically, we don't usually see that. When I get patients with lupus who come to me when their lupus is first diagnosed, they don't have a long history of infections. They usually have more of a history of the signs or symptoms of lupus. And it's often not until after I start medications, and sometimes strong medications to control their lupus, do they at times get infections. So I would say lupus by itself, although theoretically can cause increased risk of infections, it is not commonly seen. Lupus is not an indication of an underlying medical condition that is considered high risk for contracting COVID by our Centers for Disease Control here in the US. And furthermore, I would say in my patients with lupus, it tends to be the medications and how strong the medications they are on that will actually increase their risk of getting infections. And now that kind of brings me to the second most common question I get is, if the medications for lupus put me at higher risk of contracting an infection like COVID, should I cut back on them? I can't tell you how many patients have asked me this question. I don't blame them, since we have all been introduced to COVID earlier this year. And I would say it's a great question. I would say we have to really weigh the theoretical risk with the actual risk. So theoretically, if patients are on strong medications, they can be at higher risk of contracting COVID. And note that I'm not talking about medications like Plaquenil. I'm talking like medications like Cellcept, which is mycophenolate mofetil, azathioprine, which is Imuran, Cytoxan, Benlysta, which is belimumab, rituximab, talking about medications that are a little bit more of a stronger level. Medications like Plaquenil does not confer a higher risk. And this is all theoretical now when it comes to the other medications I'm talking about. The risk theoretically can be increased, but in my patients over the years, the majority of them do not get lots of infections. Only a small minority of patients sometimes gets increased risk of infections. So I would argue that if you are on medications, you have to weigh the risk and benefit between the theoretical risk of those medications increasing your risk of contracting COVID versus the real risk of stopping those medicines that were controlling your lupus. And if you do, you have to be aware that your lupus can actually flare. And if your lupus flares, you're looking at more medications, even more so like medications like prednisone, which will further increase your risk of getting infections. So, as a whole, since March, I really have not stopped the medications the majority of my lupus patients are on. I've actually continued them. I've tried minimizing medicines like steroids if they're on very high doses. I've tried actually bringing them down if they're stable, but my patients have continued their mycophenolate mofetil, which is Cellcept, their Imuran, their Benlysta, their Cytoxan. I have several patients still getting Cytoxan because I'm worried about them getting a lupus flare or problems happening that can further exacerbate or worsen their current function in their kidneys or other major organs that I'm treating. And we just watch them very, very closely and carefully. And my patients are all very on top of being extremely cautious about minimizing and mitigating their risk of contracting COVID. So overall, stronger immune suppressants, not Plaquenil, but other medications, can theoretically increase an individual's risk of contracting an infection, and especially an infection like COVID-19. However, this is theoretical, and you got to weigh the risk of stopping your medicines that are controlling you, hopefully. And if you do, that might actually lead to a flare of lupus. And at this time, we're trying to keep our patients out of the clinics as much as possible, out of the hospitals. I don't want my patients coming into the hospital for a lupus flare at this time. So just kind of wanted to let you know there may not be a black and white answer, but you really need to weigh the risk benefit profile. Next question is, will Plaquenil protect me? So, before COVID, I would argue to say that most of your family members, most of your friends had no idea what Plaquenil was. And now, thanks to COVID, the whole world knows all about your medicine, Plaquenil. In the beginning, it was hard for our patients to actually get Plaquenil. I think it has been a lot better in the last several months. I think most pharmacies and most companies that produce Plaquenil across the country and world recognize that patients with lupus definitely need it. I will say that our patients have not been having recent problems getting it. And if you are having any problems filling your Plaquenil, please reach out to your physician. And for example, at UC Irvine, we have a close connectivity with our pharmacy, and they've done a great job at making sure they do anything and everything they can to ensure that our patients will have their Plaquenil supply continued without any hiccups. So now getting to whether Plaquenil will help with COVID. In the beginning, there were quite a few reports that had actually suggested or sounded quite promising when it actually came to COVID. As data has accumulated and as some clinical trials have actually been done with Plaquenil, we've had some conflicting reports on whether Plaquenil really will be a great therapeutic option or even a preventative option for COVID, and if there are side effects that we have to be careful with when we use Plaquenil in the general population. So I would say at this point, the jury really is out, and it is not entirely clear if Plaquenil is a viable treatment option for COVID. But what I tell my patients is, listen, you're on Plaquenil, continue it. Even if there's a benefit, it's definitely worth it for you to be on if there's some benefit related to COVID. So I just want to say that we don't know for sure, but please continue taking your Plaquenil because we know the benefit for lupus is tremendous. And if there happens to be any benefit for COVID as well, that's an additional plus. Next question is it safe to go back to work? Uh, I would say back in March, we really didn't know in the United States what was going to happen with COVID. I would say that in the beginning, a lot of our patients were staying at home, were not going to work. A lot of their jobs were actually closed down at that time. Since a lot of positions have reopened back up, we have the ability to work from home. I mean, today's Friday. I was very lucky to be able to work from home this afternoon, and it's such a nice thing to be able to do that. I would say, first and foremost, if you have the ability to continue working and working remotely from home, absolutely carry on if you're able to. If you're not able to do that, I will say at least over 50% of my patients have now returned to work in a workplace. And the first question I ask them when they ask me, is it okay to go to work? Is I ask them, how safe is their workplace? I want to make sure that their workplace follows social distancing. Their workplace believes in masking and actually enforces masking in the workplace. And as much as possible, if I can get an office, some kind of a closed door setting for my patients, I will ask them to ask their managers about that. But if they can't, at the very least, I want to ensure that social distancing is followed and masking is enforced in the workplace. You know, perfect example of people going to work throughout this entire pandemic are all of us in healthcare, right? So everyone in our hospital system, in our clinic system, we've all been going to work since March. We've all been very good about wearing masks, making sure we clean our workstations that we work in, the rooms that our patients come to. We're trying to make a very good effort about keeping distance between myself and the nurses and our other faculty and patients when we're all in clinic. And it's a perfect example of showing that if you follow social distancing and if you adhere to masking, that the risk of contracting COVID is quite low. So, just to give you an example of someone who's been going to work since March, and fortunately, I'm not aware, but fortunately, I have not contracted COVID. And at some point, given how prevalent COVID is, it is very likely that the majority of the world will contract COVID. And everything that we're doing right now with social distancing and masking is to try to delay us from contracting COVID as much as we're feasibly able to do so. So again, if you are doing well and if you are able to go back to work, I would have a conversation with your physician. But from what I've done with my patients, I absolutely recommend they go back to work if they're able to. If they can do it remotely, I recommend remotely. If they cannot, I try to make sure that they're in a safe work environment. And if they are, I give them, my complete okay. And there have been times I've had to actually write letters to say, the patient is okay to go back to work. Please ensure that social distancing and masking is actually followed in the specific areas where they work. I would say in our own experience in the healthcare industry, where we've seen people like healthcare workers actually get infections like COVID, has not actually been from patients. The majority of COVID infections that we've had with our healthcare workers in my institution has actually been from the break rooms and has actually been from social life. It has not actually been from the workplace. So what happens is during the lunch hour, everyone goes into these sometimes very small break rooms. They take off their masks, they're talking to one another, and you have to be extremely cautious because that's a perfect time for things to actually spread a lot easier. A lot of the cases when patients have actually, sorry, when our healthcare workers have actually contracted COVID, don't come only from the break rooms and the break areas in our clinics or in the hospitals, but from what they were doing the weekend before, from interacting with family, friends, and then them contracting it from somewhere there. So just want to give you an idea. I hope this is reassuring that if we follow social distancing, we're extremely conscientious and careful, that you can really mitigate your risk quite a bit. Next question. How can I tell the difference between lupus and COVID-19? And I think this is a great question because lupus, when it presents or when our patients get a flare, you can get fevers, you can get joint pains, you can get muscle pains, you can feel pretty crummy, you can get chest pain, shortness of breath. And you see when you look at COVID or other types of infections like the flu, a lot of these symptoms actually overlap. I will tell you there are unique symptoms that most patients with lupus do not complain about when they get a lupus flare, and that's sore throat. That's not a common symptom my lupus patients will complain about when they get a lupus flare. Loss of taste or loss of smell. These are all kind of specific symptoms that are a lot more specific for something infectious going on than for their lupus. And I would urge you, you all know your lupus better than anyone else does. I mean, I have patients who have had lupus longer than I've taken care of them. And when they ask me, is this a lupus flare? My first question back to them is, what do you think? Are these symptoms in line with your prior symptoms of lupus when you get a lupus flare, or is there something different about them? So I would say that if you get symptoms and you're concerned, the first question you want to ask is this like my typical traditional lupus flare? And if it is, I don't want you to be alarmed. But if there are symptoms that are different, if there are symptoms that are unique, like sore throat, loss of taste, or loss of smell, then I would urge you to actually reach out to your physician or your rheumatologist or your primary care physician. But actually, over the months, it's been a lot easier for the majority of my patients to be able to ascertain, yeah, this really is my lupus. A lot of them call me and they're worried. And when we kind of walk through, is this like your lupus symptoms? And they say yes. Usually they feel a lot more reassured after talking it through. So I hope that helps. The next question I get is, can my child go back to school if I have lupus? And I think this is a great question. In the United States right now, there are so many different regulations from state to state, county to county on our schools opening up. Is it hybrid? Is it virtual? That I know it's a really difficult question to actually answer for everybody. I will say, as a mother of two, my son is 10, my daughter is 14. I was concerned. I was concerned because I just wasn't sure if they went back to school, if they contracted COVID, if I would get it, and in turn, if it would affect my ability to take care of my lupus patients in clinic. So I'm with you guys on these concerns. I would say that if there is a virtual option, and if you're able to do a virtual option, for me, I have to go to work. My husband is able to actually stay at home with the kids and work remotely. So that helps tremendously. So we were able to do the virtual option without significant problem. But it depends on what options are available and economically what you guys can do. So if there isn't an option for the kids to stay at home, and if your kids need to go back to school, I would inquire with the school about what they're doing to mitigate the risk. I would inquire the same things that you would inquire if you're going to return to a workplace. Are they masking? Are they social distancing? I've heard of a lot of schools putting up plastic shields around their desk, which I think is actually a wonderful idea and a great idea for them to actually do. You also want to inquire about what happens when they're out of the classroom, because my concern with the kids was not always what's going to happen when they're in the classroom, where there's a teacher there, and if everyone's masked and they're all kind of spread around, spread apart, that's okay. But what happens if there's a lunch hour? What happens if there's a break? You want to make sure at times like this that there are safe practices that are being enforced. And so I would say, right now, for example, my kids are virtual, but where we live in Southern California, they are really thinking in the near future of opening up their schools. I have sent, several emails asking about what the kind of all of the rules and regulations are to that, and what they're going to be doing when students go back, so I feel more comfortable. And, if the students have to go back and you have no other option, it's education. It's educating your student, excuse me, on proper hand washing, maybe making sure they have hand sanitizer with them in their backpacks, uh, kind of educating them on the importance of wearing a mask, finding a mask that's comfortable for them to actually wear when they go back to school, because it is not easy for little ones to be wearing a mask all the time. Showing them how to wear a mask, maybe practicing it at home before they actually go to school, is a good thing. Back to school and wear a mask for hours at a time. I would actually recommend trying it on a day at home for hours at a time, everyone in the family wearing a mask, and trying to see their comfort level with it. So doing some of these things before your student actually goes back to school, so they feel more comfortable. And I would say, don't be fearful of it. if they have to, being the most important thing is them trying to be as conscientious as possible at decreasing their risk. And like I said, all of us in healthcare and so many other industries that have had to be open during this period of time with COVID, as long as people are safe and follow social distancing, hand washing, and wearing a mask, people really decrease their risk quite a bit. Okay. So, I would say if you have an option virtual, if you don't have a virtual option, or really it just doesn't work for your family or for kind of how things work for you guys at home, then I would say if they go back to school, inquire about what safety practices they're going to be doing. Really spend some time with your kids, kind of teaching them about the importance of it, that listen, we don't want you to get something, or we don't want you to get something and bring it home, and then we don't want to get something. Like COVID, especially if you're immune suppressed. Ideas, if your kids are going to school right when they kind of walk in, do not maybe bring the backpack in the house, maybe keep the backpack kind of like in the garage or kind of, outside a little bit for a period of time. Just have them bring their papers and things like that in. Maybe the first thing they do when they go get home is actually take a shower, completely change out of their clothes, completely take a shower, and change into a clean pair of clothes. Just giving you an idea of what we do as healthcare workers right now with working in the hospital and coming back home, just to try to mitigate the risk as much as possible. Let me just make sure I've actually covered everything when it came to that. And then what do you do if you're exposed to someone with COVID-19? I would say this has happened over these last several months. I will find out about a patient that came to clinic that ended up testing later for COVID-19. We'll find out about other healthcare workers that might have had COVID-19, or even friends and family that have contracted COVID-19. And the best thing to do is to not be alarmed. You want to remain calm and collected. You may not contract it. You want to watch your symptoms. Just kind of maybe if you have a thermometer at home, you can even consider checking your temperature on a daily basis. Watch your symptoms. Be very conscientious if you develop any symptoms. And then the next thing to do is to call your physician if you have any symptoms. As my patients have called me, if they have no symptoms at all, and if they're just worried, I've not tested them. I've actually just told them exactly this. I just want you to watch your symptoms, be conscientious, try to stay away from a lot of other people in case you contracted COVID, just to minimize the risk of spreading it to other people, and only kind of contact me again if you actually are having any symptoms that are out of the blue, kind of concerning for you getting an infection. So that's what I would actually say, is just monitoring yourself and quarantining. And then, we've had a lot of questions on when will the vaccine come out, and when it does, will it be safe and effective for lupus? We don't have an exact answer in the United States of America on exactly when the vaccine is going to come out. In other countries around the world, it might actually come out at different times. The FDA is very stringent on what they will allow and will not allow, and they want to make sure it's a safe vaccine, an effective vaccine, before they approve it for use in our country. But we are getting close. Some people are asking me for a date. I'm unable to give a date, but we are actually getting closer to getting a vaccine out. I don't know the details on what this vaccine will look like, because there are several, if not many more companies, pharmaceutical companies, that have all been working really, really tirelessly on trying to find a vaccine as soon as possible and trying to vet it with patients through clinical trials, that I don't know the details of all the vaccines. But once a vaccine comes out, the general kind of rule of thumb to remember is if you are on a lot of strong immunosuppressants, vaccines are still okay as long as they are dead or inactivated. So, for example, the flu shot. If you get an influenza vaccine or the flu shot, for example, it is a dead flu virus. It is okay for you to get it as long as you're not allergic to any of the components in it. It is okay for you to get a flu vaccine, even if you are on immunosuppressant medications. And that's often a misnomer. There are a lot of patients that come in and say, you know what, my family, my friends, the internet said that if you have an autoimmune condition, that you should not actually be taking the flu shot, or if you're on medicines to suppress your immune system, you should not get the flu shot. And I tell them it's actually exactly the opposite. For my patients that are on medicines that suppress their immune system, I absolutely want them to get the flu shot. I want them to get any vaccine that they can get that will prevent their risk of getting infections. So the only vaccines you need to be cautious with, if you're on biologic type medicines or strong immune suppressant medications, and those are live vaccines. So if it is a live vaccine, you have to be cautious and you need to ask your physician. But if it is a dead or inactivated vaccine, it is absolutely safe for you to get. So I hope this helps. And this is exactly what I've been telling my patients. Every week when my patients come in, I ask them how their lupus is doing, but I always end with, have you had a flu shot? And if they've never had any allergy or contraindications to a flu shot, I've been giving all my patients flu shots because in this season, I don't know, none of us know what the combination of flu, influenza, and COVID is going to look like. And so even if some of my patients have kind of shied away from a flu shot in the past, I've highly recommended this year be the year they get the flu shot, because I do not want to learn through them what might happen if they end up getting two infections simultaneously. So I would strongly urge everyone to get the influenza vaccine, which is the shot, which is inactivated, as long as you have no contraindications for it. And when the COVID-19 vaccine comes out, hopefully sometime in the near future, but when it does come out, depending on your respective kind of countries, just making sure it is a dead inactivated vaccine. And as long as it is, there really should be no contraindications to you trying the vaccine. And I think those were kind of the top questions that I continue to get from my patients week by week. I do have Brianna on the line from Lupus LA, and I was going to go ahead and turn it over to her. And I have her on my phone in case, she's been fielding questions and kind of looking at the chats. And if she has any additional questions, I'm actually quite happy to take them. So I'm going to turn it over to Brianna. Brianna, are you there?
I am. Hi, Dr. Desai. Thank you so much for joining us.
Yes, thank you. Are there any questions? I know it's 3:28, but I'm happy to take a couple of questions that might have come through to help answer.
Absolutely. We are getting live questions. And the first one from our social community says, can I live a normal life with lupus alpoli?
Okay, and I will repeat the question in case they can't hear you. Can I live a normal life with lupus, right?
Yes.
Perfect. So my answer to that is absolutely. That is the goal. That is my goal for all of my lupus patients, is for them to live a normal life, for my females and males, any of them to be productive in what they want to do, for them to finish their education, for them to actually be able to be in an intimate relationship, for my females to be able to have successful pregnancies in the future. That is my wish for all of my patients. I will tell you that when it comes to lupus over all of these years, we have actually seen dramatic advancements in the longevity of lupus patients, going back from the 1940s when steroids actually hit the market and were FDA approved, because they really calmed down significant flares of lupus. Then in the 1960s and early 70s, when dialysis actually hit the market, really we've come a long way in improving the life of our patients in the last couple of decades, even more so with the use of all the immunosuppressants we have on the market. So I would say in this era, lupus patients with continued management and treatment can live very normal lives as long as they follow up with their physician, they get lab tests on a frequent basis, because often your doctors will listen to you, examine you, but there are sometimes things that they see in lab examinations that they do not hear or see when they physically examine you. And so for me, I take what my patient says, I combine it with what I see when I physically examine them and their lab. and I put all of it together, and we try to decide if there's still some lupus activity, how we can actually kind of dial up their treatment, both either medically or what they do kind of outside of the office with stress management and taking really good care of themselves. So absolutely is my answer to that. And then Brianna, I just took you off again. Is there another question I can help answer?
Yes. The next question is, I tend to flare around ovulation and sometimes right before my period as well. Is there a specific hormone that's responsible for this? What can be done to control or better this problem?
That's a great question. I will tell you that a lot of my patients actually notice this. And, if you guys had to guess, and I wish I could hear you guys, but I'm sure many of you guys out there would guess the correct answer. The one hormone that's most commonly linked to lupus, which increases the risk, is estrogen. And that's why when patients are kind of on their period or right around ovulation, when there are subtle increases in these hormones that are actually happening in the body, that's when the estrogen actually kind of is stimulated. It actually can stimulate really subtle flares or a worsening of any of the symptoms you have with lupus. And it's not just lupus. I don't know about you guys, but when I notice it, when I've actually gone in to do my eyebrows, for example, in the past, when I've done something like that, and when I'm threading my eyebrows, and if I'm wincing all the time, the first question the person, the beauty expert will ask me is, are you on your period? Are you right now mid-cycle? And I'll often say, well, yeah, why? Why are you asking me that? And they said, you know what? Women's pain, actually, their pain threshold, they get a lot more sensitive with these subtle kind of hormonal fluctuations that happen to all of us women throughout our cycle. So it is absolutely real what you guys are feeling when you notice during ovulation or even during your menstrual cycle that you're a lot more sensitive to pain, and you might even notice some mini flares. I would suggest that if it's pretty bad and if it's causing a lot of symptoms, talking to your doctor or seeking the care of an OBGYN, a gynecologist, to see if there's something that can be done, maybe in the form of different types of birth control that are safe with lupus, to see if some of that hormonal surge can be controlled a bit, and that in turn may actually help with some of the symptoms. But what you're noticing is due to estrogen for the most part. And then is there a last question I could take? I know it's 3:33, but I would love to take one more question if possible.
Yes. Do women with lupus face fertility issues more often than women without lupus? If yes, why is that?
Great question. Fertility, that's something I'm extremely sensitive about, because I would never want to tell any of my lupus patients that you cannot get pregnant. And I am a complete advocate for them having children and them becoming pregnant. It's all about doing it at the right time, though. So first, fertility. Fertility is the ability to get pregnant. When studies have been done looking at patients with lupus and patients in the general population, they've actually found that the fertility overall for patients with lupus is very similar to that of the general population. I'm going to say it again. The fertility for my lupus patients, the ability to get pregnant, is very similar to the general population. There are times where it might be slightly decreased, and it might be slightly decreased in patients who have been on chemotherapy drugs that might affect the amount of eggs that they actually have in their ovaries. It might be lower in patients slightly if they're on very high doses of steroids, because very high doses of prednisone can actually mess up your regulation of your ovulatory cycles. It can actually be affected if someone has antiphospholipid antibodies or antiphospholipid syndrome along with lupus. But if you don't have antiphospholipid antibodies, you haven't been on medications like Cytoxan that can affect the amount of eggs you have in your ovaries, and if you're not on very high doses of steroids, the chances of you actually being fertile and getting pregnant is very similar to the general population. The next step is actually pregnancy. Pregnancy is a state where we have a lot more estrogen in our bodies than we do when we're not pregnant. And we know that estrogen is really linked to lupus, and estrogen at higher levels can actually tip over people with lupus. So pregnancies with lupus, they can go great, but they do have a higher risk of complications than the general population when it comes to complications. So that's why I tell my patients that I absolutely want them to get pregnant. We just have to make sure that their lupus is stable, have to make sure they're not on medicines that are unsafe to get pregnant on, because several of our medications like methotrexate, mycophenolate mofetil, cyclophosphamide, which is Cytoxan, these are medicines, leflunomide, that are actually teratogenic, and you cannot be on them. So in my lupus clinic on Tuesday, I just saw a young female who brought up that, she wants to get pregnant, not now, but in the near future. She has lupus nephritis affecting her kidneys. She is on Cellcept. And I told her that when the right time comes, we're going to, when she's ready, because I told her we can start decreasing the medicines and seeing how she does, make sure she stays stable before she plans on getting pregnant. So the best odds of having a successful pregnancy is ensuring that the 6 months before you get pregnant, that your lupus is as stable as possible. And that will actually increase the odds of a successful pregnancy. And again, just to circle back to the initial question, when it comes to fertility, overall lupus patients are just as fertile as the general population, with some minor exceptions that might actually decrease the fertility a bit. I hope that answered some of the questions, and I thank you guys all for having me on Lupus LA on this Facebook kind of live chat. I think this is a wonderful opportunity for us to be able to disseminate information to all of you more frequently and regularly. So thank you, and I hope all of you guys stay safe and healthy, and take care of all of those around you as well. This truly is something that we can do to help one another, and this is a community kind of situation we are all in with the pandemic.